Good afternoon again. I'm Abby from Orlando Medical Institute. We are here streaming live at ClinCon. I have had the pleasure, I'm actually having the pleasure right now of sitting and talking with the Sean Fix. Hello, sir. Thank you for taking a few minutes to talk with us.
Good afternoon. Thank you for having me.
Thank you, thank you. So tell me, I know you do lots of things in the EMS community, but what are you doing now in ClinCon? What's happening these few days? What are we doing?
So the first few days, we're working on the EMLRC, the ClinCon competition.
Great.
So we had a little over 30 teams do EMS competition. We had some student teams, a couple of BLS teams, and some ALS teams from around the state and outside of Florida competing.
Yeah.
And we just finished the preliminary, so we're finishing that. We're working on getting ready for the final 5 teams tomorrow. And then tomorrow afternoon, I'll be speaking on advanced airway management, specifically rapid sequence intubation, and some pros and cons, and should we do it, should we not do it, if we're going to do it, how should we do it, and what are some things we should be prepared for. And Saturday, I will be speaking on community paramedic and mobile integrated healthcare, and I'm attacking that from the provider level. And I'm doing a program called, I don't feel like a paramedic, what am I as a community paramedic?
Gotcha.
So it's really kind of an entry level for the street provider of, kind of what is this community paramedic thing that everybody's talking about. And then in the afternoon, I'm going to talk about some geriatric concerns and things we should think about in the elderly population, because we have a little bit of that in Florida.
Got you. So you're doing a little bit of everything, but aside from the amazing stuff that you're doing here at ClinCon, what does Mr. Fix do outside of here? Tell me about emergency medical consultants. What's going on with that?
So, yeah, we do, a lot of training. We train about 21,000 people a year, and
Great.
we do a little bit of hospital stuff, a little bit of EMS stuff, a little bit of corporate stuff. Right now we do a lot of the standard courses, so we're doing ACLS around the country.
Gotcha.
Both at the fire and EMS level, at the hospital level, and then the standard classes, PALS, the trauma classes, ITLS, the nursing level classes, ENPC, TNCC, the PHTLS trauma classes, and then we have a series of our own custom classes we do.
Okay.
Emergency airway management, emergency trauma management, cricothyrotomy, specific stuff, and we'll basically drop in and do a custom course for any type of emergency medicine group who needs it, whether it's a group of residents who say, hey, we want our new physicians to get specifics on emergency airway for 2 hours or 4 hours or 6 hours or something like that. So we have a list that we have put together, or we'll customize something if somebody needs it. So that's kind of our gig.
That's great. So just to go back a little bit, you're going to be speaking for the next few days on your expertise, which we always look forward to that because I've sat in that lecture sometime before. And as far as the scheduling for emergency medical consultants with all these great classes that you offer, where can I access that schedule? Who can I get a hold of when I need a class?
Good. Well, if you need us, and our niche has kind of been that we'll bring the class to your site. Anywhere in the country,
Yes.
we'll show up there and bring a class. All we need is a room. And you can look at our website, which is medicaltraining.cc. You can call our office, which is 772-878-3085, or you can email us, which is from emcoffice@gmail.com.
That is great. That is great to hear. Well, thank you so much for giving me a few minutes of your time. I know you've got lots going on, and I look forward to your lecture. We'll actually chime in on that if that's okay and give a little bit to the world, just a taste.
Perfect.
Okay?
Look forward to seeing you.
Thank you so much.
Thank you.
Thanks, guys. Talk to you later.
Thank you. Bye.